While Australia is expected to avoid a significant surge in COVID-19 cases when mandatory isolation is removed, public health experts are wary of the message the decision sends to the public. From October 14, Australians will no longer need to isolate for 5 days if they contract COVID-19 after Prime Minister Anthony Albanese and state and territory leaders on Friday agreed to the change. Watch the video above. COVID isolation rules scrapped. For more health and well-being related news and videos, check out Health and Wellbeing. Chief Medical Officer Paul Kelly also backed the decision, saying the emergency response phase of the virus had passed. We will almost certainly see future peaks of the virus, as we have seen earlier in this year, he said. It is a time, though, now to consider that we have other things that we can do to protect those most vulnerable people, and that is absolutely our key aim. University of Melbourne epidemiologist Tony Blakely says he is not too worried about the measure and it will lead to only a slight increase in cases, hospitalization and deaths. But he warns people should be aware mandatory isolation could one day return. This measure's not enough in and of itself to cause another surge, he said. There's almost certainly going to be another wave sometime later this year. That surge itself, if we don't have mandatory isolation, will be slightly worse. There will be more cases, there will be more hospitalizations, there will be more deaths. How much more? I really don't know. So as long as the public realizes we may need to reinstate some of these public measures if things go badly, but we can take them off for now, then I think that's a reasonably good place to be in. Kelly has not ruled out the prospect of mandatory isolation coming back. Professor Sanjaya Senanayak, an infectious diseases doctor in Canberra, said Friday's decision was reasonable, but people need to take steps to avoid spreading the virus. It shouldn't be carte blanche for people with COVID to necessarily go into the community or into the workplace, even if they're allowed to, he said. People who are really symptomatic, coughing, spluttering, sneezing, who are at increased risk of transmitting COVID should perhaps think about staying away from people until that settles, or until they get a negative RAT test. Mandated or recommended? Public health expert Katie Bell is concerned the message will become muddied, with people incorrectly interpreting the change as meaning they are no longer recommended to isolate if they're sick. People are still being recommended that they should isolate if they're a confirmed case, the University of Sydney academic said. It seems to me that, in NSW at least, that a number of mandatory measures that have been relaxed, just because they're not mandatory, the general interpretation is that they're not recommended. Loading tweets. Some health practitioners have decried the decision, including University of South Australian epidemiologist Adrian Esterman, who labelled it clearly a political decision rather than a public health one. But the chief health officer has insisted removing isolation measures was reasonable. It is time to move away from COVID exceptionalism, in my view, and think about what we should do to protect people from any respiratory disease, Kelly said. We can't look at isolation by itself. We need to look at those measures and the protections we have as well as other protections. It is important that we keep an option for a change to these settings in the future.